COVID-19 is a public health crisis impacting all parts of our DC healthcare network. All residents need access to comprehensive medical care, and they need to be safe and as healthy as possible.
Hello.
The DC government must take care of our essential workers, and especially those who are vulnerable to the virus.
We, the people of DC, demand that hospitals will ensure that folks giving birth can have the support team they choose, and that the DC government will provide increased funding for birthing centers and midwives who do home births.
The DC government will ensure that healthcare facilities will have all the medical equipment, ventilators, PPE, and everything else that they need.
DC government will increase funding and housing for domestic violence organizations.
We, the people of DC, demand that the DC government will financially support mental health hotlines and provide year-long therapy vouchers for whoever needs them.
We, the people of DC, demand that DC Public Schools and the DC Public Charter School Board ensure that all schools provide therapists to actively reach out to schools and young people. Once students return to schools, the DC government should provide money for mental health support in all schools.
We, the people of DC, demand that the DC government will increase access to COVID-19 testing,
Especially in wards 7 and 8.
We demand that DC government will ensure that access to testing is equitable and accessible,
Including language accessibility.
that the DC government will distribute testing kits to community-based organizations that provide medical services like Bread for the City, Mary Center, and Community of Hope to administer testing.
We, the people of DC, demand that ICE and MPD stay at all hospitals.
We, the people of DC, demand the DC government ensure the continuation of essential services such as abortion access and contraceptive access.
We, the people of DC, demand that the DC government ensures all residents will still be able to access non-COVID related medicines.
We, the people of DC, demand that DC government ease the process to access methadone to reduce long lines where social distancing has become a problem. Allow people to have multiple doses to reduce visits.
We, the people of DC, demand that the DC government will ensure that telehealth and telemedicine options be made available to all who need it, with a particular focus on Black people, trans folks, and communities with low incomes.
DC government and Children's Hospital will protect school nurses from layoffs due to school closures.